Pramodh Chandrasinghe, a surgeon with a special interest in colorectal surgery. I will be discussing about constipation, a common symptom coming up with patients nowadays. Constipation is a word that is loosely used by both patients and doctors to describe a reduction in the frequency of passage of stools, any discomfort, any pain, passing hard stools, or having to strain during defecation. Constipation, the condition constipation can be due to many reasons. It can be due to a luminal obstruction, it can be due to a reduction in the function of the colon, or it can be due to an obstruction or a difficulty in evacuating the stools. Most of us may have felt constipated at one time or the other. But if constipation persists for more than a period of 2 weeks, you need to seek for medical advice. Because most importantly, constipation can be the alarming symptom of a colorectal cancer, especially if you're above the age of 50 years of age. From many causes of constipation, the obstruction to the lumen can be caused by a cancer or an inflammation or a stricture in the colon. The function may be affected by thyroxine hormone levels or ions like calcium in your blood. And the dysfunction to evacuation can occur due to a dysfunction of the muscles in your perineum. It can be due to the weakness of the muscles or hyperactivity of the muscles. When a patient comes with constipation, the first step is to do a luminal assessment, where we use colonoscopy or flexible sigmoidoscopy to exclude the possibility of obstruction into the lumen of the colon. Functional assessment is done through 6-month study, where we give a radio-opaque capsule to be ingested, and by taking serial X-rays over a period of 7 days. We also may do blood tests such as serum TSH levels to assess the function of the thyroxine hormone and the calcium levels. These are for the functional assessment of the colon. In order to evaluate the obstructed defecation, there are special tests such as dynamic pelvic MRI, where a gel will be inserted into the rectum and you will be asked to evacuate while you're inside the MRI machine. This will give us an idea of the functioning of the perineal muscles and whether there is any prolapse of the pelvic organs such as the rectum, the womb, or your bladder, which can all affect evacuation, and also the function of the pelvic muscles, which can be sometimes hyperactive or hypoactive. Anorectal manometry is also a new test that is available to gauge the functioning of the perineal muscles. By doing anorectal manometry, we can get an idea about the function and the pressures of the perineal muscles. Obstructed defecation is a component in constipation that goes mostly unnoticed because patients are not able to explain their symptoms accurately, and sometimes the evaluation of the condition is not done properly. So new imaging modalities such as dynamic pelvic MRI and anorectal manometry can help in accurate diagnosis of this condition. The management of these can be done depending on the cause with medication, and in cases of evacuation dysfunction, it is mainly done with biofeedback therapy, a controlled supervised exercise program done by a trained therapist. And sometimes patients might need surgery to correct the pelvic floor dysfunction and support the evacuation.